Hello everyone. Today let's get started on our next important topic, that is our primary immunodeficiency disorders. This topic I have taken it from our IJPP and as well as from IAP article. So I have concised your primary immunodeficiency disorders. I have taken only the main points. Okay, very useful for your university exam and as well as for your clinical or practical purpose. So when do you suspect a child to have a primary immunodeficiency disease? So that is when the child is having more than or equal to 4 new ear infections per year. Next, more than or equal to 2 serious sinus infection in a year. Or when the child is having a more than or equal to 2 pneumonia, that is more than or equal to 2 pneumonia episodes, separate episodes within a 1 year period. Or when the child is having more than or equal to 2 deep-seated infections including septicemia. Or when the child is having a more than or equal to 2 months of usage of your antibiotics. So 2 months of antibiotic usage, you suspect the child to have a primary immunodeficiency disease. Sixth point, when the child is having a persistent thrush in the mouth or a fungal infection on a skin. So persistent oral thrush, or you have a fungal infection in the skin, right? Persistent, okay, you should mention the word persistent oral thrush or a fungal infection on a skin. Or when the child is needing or IV antibiotics for a longer time to clear an infection. So needed for a IV antibiotics for a longer time to clear any infection. Next is when the child is having recurrent deep skin or organ abscess, or recurrent deep skin or any organ abscess. Ninth point, when the child is having a family history of primary immunodeficiency disorder. 10th point is when the child or in the infant is having a failure to gain weight or there is a grow normally. When there is a failure to gain weight or grow normally, this is when you suspect the child is to have a primary immunodeficiency disease. So coming to a classification of your primary immunodeficiency disease, there are 8 major categories. So this one I have taken it from your IAP article. Okay, so they have simplified it as 8 major categories. First one is combined T and B cell defect. So when there is a combined T and B cell defect. Second classification is predominantly antibody deficient. So predominantly an antibody deficient. Third is when the child is having other well-defined immunodeficiency. Fourth point, when the child is, or when the fourth classification is disease of immune dysregulation. Fifth point, phagocyte defect. Fifth classification is your defect in your phagocyte. Either it can be number of phagocytes or it can be a function of your phagocyte. Sixth classification is defect in innate immunity. And there is a defect in innate immunity. Seventh, when there is an autoinflammatory disorders. Eighth classification is your complement deficiency or complement disorders or complement deficiency. So today I have taken as your combined T and B cell defect and predominantly antibody deficiency. We will discuss these two topics here. Yes, first is your combined T and B cell defect. First one is your SCID, that is your severe combined immunodeficiency. There are around 22 group of disease in this classification. So there are around 22 group of disease. For example, the child can have a ADA deficiency. Second, RAG1 or 2 deficiency. Third, alpha chain deficiency. Fourth is your JAK deficiency. And fifth will be your CD40 ligand deficiency. That is when when there is a CD40 ligand deficiency, you suspect the child to have a X-linked hyper IgM syndrome. So when the child is having a severe combined immunodeficiency, the age of presentation will be around 6 months. Okay, yes. And the clinical manifestation are, first one is your failure to thrive. Second one will be your chronic diarrhea. Third one, the child can present with pneumonia, sepsis. 10 minutes wait panna sir. And the child can also have your oral thrush, or the child can also have a disseminated BCG infection. Right? Yes. So these are the pointers actually we have read first to tell that the child is having a primary immunodeficiency disease. Yes, the organism that can be mainly involved in your severe combined immunodeficiency are, from first bacterial organisms are your Campylobacter jejuni. All the organism, like all pyogenic bacteria can be related to a child with severe combined immunodeficiency, but these are your particular bacteria. That is your Campylobacter, and another one is your